Welcome to the DMF podcast, where you will get to hear conversations with community leaders, charity spotlights, and information on upcoming DMF events. I'm your host, Whitney Isaacson, and today I sat down with Jason Schaff. He's an optometrist at Valley Vision Clinic in Grand Forks, and he sat down to tell us all about vision and eye care health, and specifically how we can help kids see a brighter future. I think you're really going to enjoy this episode today, so let's get into it. All right, well, welcome, Jason, to the podcast. We are so excited to be sitting down with you today and talking all things eyes.
I'm happy to be here. Thanks for having me.
Wonderful. So can you tell us a little bit about your clinic and how you chose to be an optometrist?
Sure. Well, I started, goes back a long time. I was 7 and I went for my first eye exam, I'm sure, and I couldn't see very good. And I got my first pair of glasses, came out of the store with them or whatever, and all of a sudden I could see everything. It's kind of the aha moment that people talk about a lot, and I was pretty much hooked when I was a second grader. I wrote down on a piece of paper, I'm going to be an optometrist when I'm older. Every year I had the similar type experiences. I kept getting worse, and went to college, did the things, answered the questions on all the surveys that made me get to be an optometrist.
Right.
That's what I decided I wanted to do.
Right.
So I landed in Grand Forks, and I've been at Valley Vision Clinic there since 2008.
Okay.
Yeah.
So you've been there for quite a few years now. So what are you most passionate about in your role?
So, I think most optometrists would say that they didn't get into it for any fame and glory, because optometry isn't really full of that. It's because we just like to help people. And generally, I'm a problem solver. I like to see what's wrong, find people's answers, and give them to them, and try to be useful.
Right.
So that's what gets me going.
Right. So what does it look like when patients come into your clinic? What is it, like an initial screening? What happens when there are concerns? What do those treatment plans look like? Or walk us through what that looks like.
Optometry is such a wide range of things. I primary care practice, so I see everybody from age 1 to age 100, and so it varies. There's people in just run of the mill, need glasses, can't see very good, to kind of complex vision threatening diseases, neurology type diseases that just go through the motions, help them the way we can, make sure we keep things from getting worse.
Right.
Preserve vision. That's what we're trying to do.
So what are some common issues that kind of are flagged in your clinic?
So, for kids, it's the standard nearsighted, farsighted, astigmatism, amblyopia is kind of a big thing that we're trying to look out for there. And then as they get older, it's just the big ones are diabetic, retinopathy, changes from diabetes that happen to people, glaucoma, macular degeneration, cataracts, the usual suspects of things that kind of can affect vision as we age. So it varies, and practice varies from day to day. And so it depends on who's in the chair. Okay.
Yeah. So once you diagnose someone, do you walk them through the treatment plan, and then are you walking alongside them through that treatment?
That's the idea. And in fact, probably get to do most of the treatment in my office. And so really kind of depends on what it is, but that's the thing. It's like a primary care relationship. Even if there's things we need to, reach out to our colleagues for surgical intervention for, it's one of those things that the patient still ends up back with me. And so you really develop long-term relationships with patients that are kind of, I'm going to be here with you. The outcome matters to me just as much as it matters to you, because you're still going to be sitting here, and I still got to be happy with the way it happened, or the outcome that you got. And so it's a lifetime commitment to be with patient and help them as best you can. And I've been doing it long enough now. It's 16 years, 17 years, whatever it is, that I have kids I've seen that are now adults, and I'm seeing their children, and it's kind of a strange feeling to watch people or be with people long enough to go through that whole deal. But
yes. Well, thank you for all that you do. I'm sure it's so fun to work also in a small town and just get to know the community, because you're their optometrist.
That is a thing. Yeah.
Well, I think about myself, and I wear glasses, and I always joke that I have horrible vision, but I've never really thought about what it would look like if I had some other condition and what that treatment would look like. Is there something I should be thinking about, being concerned about, or what would be like a common thing for someone like myself?
So for someone your age, it's more of a conversation about, can I see clearly? Most people aren't going to miss that. They're going to know whether they're seeing good or not. It's some little things that, frankly, you don't get to know that are happening to you, which makes eye care kind of an interesting deal. The scary things that cause us to lose vision, we don't have any symptoms for. And so, as self-serving as it might sound, having somebody check your eyes routinely, even if you see great and don't have any problems, is really the key. And that's what, when it comes to even children's vision, same story. They don't know that they can't see good, or they have no idea that what normal is. And so parents are always really quick to say, well, I didn't know they couldn't see. They didn't say anything. Mm-hmm. Why would they say anything? That's their normal, right?
Yes.
And so symptoms are hard because it doesn't always lead to the answer for our profession in a way. And it's one of those things that's just like the dentist. You don't know you got a problem until you see the dentist enough times until your tooth hurts, right?
Right.
And so that's why the dentist likes to look before it hurts. Mm-hmm. And so same deal for us. We need to look before you've lost your vision so that we can keep you from losing your vision.
Right. So a lot of people, I guess maybe in my personal opinion, overlook eye health. We always go to the doctor for a physical. We tend to always go to the dentist for the most part, unless you're scared of them like me.
Me too.
But why do people overlook eye health?
I don't know. I'd like to say that optometry as a profession, or eye care as a profession, probably gets an F for our public health initiatives. We were behind the 8 ball on making sure people knew that eye care, what we do in eye care. And frankly, that's probably unfair a bit. What we do has changed a ton in the last 20 years. And so people just don't know. And when you don't know, you don't know, and sometimes you don't know what you don't know. And that's when it gets in trouble. And that's why, our foundation is really trying to let people know, kids' vision, how it affects them, how it can affect their learning. It isn't just about seeing clear and not seeing clear. And so there's so many functional things that, we could talk about with that. But optometry just generally hasn't done a great job, for lack of a better word, to answer that question. It's been short on letting people know what to do. Right.
And like you said, like people, you don't know there's an issue until you can't see. And then you're like, oh crap, where do I go? An optometrist. But it's not first of mind of like, oh, I'm young, I should get my eyes checked. So there's a baseline in case I ever need to go.
Yeah, that's exactly right. You nailed it.
Okay.
We need to scream that from the rooftops is what we need to do.
Right.
And it doesn't matter how many testimonials of patients you can get. It's hard to change behavior, especially on a macro level like that. It's not easy.
Yeah. It's hard to change behavior until there's
and hopefully people a lot smarter than me are working on it, because I'm definitely not the guy to be doing that. But that's a pretty well documented in our profession conversation.
Okay. Well, you touched a little bit about the foundation. You're also the board chair of the Optometric Foundation of North Dakota. What does that look like, and how long have you been a part of that?
Yeah. So the Optometric Foundation, I joined, I'd be guessing a little bit, probably 2010, 2012. We were blessed to receive a pretty good endowment from Vision Services Incorporated, which was a vision insurance in the state of North Dakota. And I kind of came with that endowment, and we wanted to make sure that endowment turned into something useful for the entire state and would be impactful to the citizens of North Dakota, visually. And so what we try to do, our first initiative has been to kind of cure out this kids' vision thing, for lack of a better word, and really try to decrease the amount of kids that have functional vision problems, specifically undiagnosed amblyopia, which is a condition where one of your eyes just doesn't see very good. And so regardless of whether you have glasses or contacts on, it just can't see. And so really there's no excuse to have amblyopia. If you get seen by an optometrist or an ophthalmologist, you will get diagnosed correctly, and they will know that it's there, and we can stop it from causing that inability to see.
Right. And so I know the foundation, the program you're mentioning is Vision Start, which I know also has about 50 providers, optometrists across the state of North Dakota that are giving out these eye exams to kids, and they're free, correct?
Correct. So the foundation's job is to kind of help facilitate these children getting these exams, and so to the patients is no cost to get the exam, so that they can find out whether or not they are in that group we're trying to stop. There's such a big difference between a vision screening that is done by a local school nurse or a Lions Club type of deal and an actual functional vision exam that would take me out. We could talk about it for hours.
Right. And a lot of people don't know that.
Exactly. Just because we can read letters doesn't mean we really solved the problem or answered all the questions that, we need to know about. And if we know you have a small prescription on a screening, that doesn't mean that you don't need glasses. And so what's hard about being a kid or being any farsighted patient is that they can still see good even without their glasses on in most cases. And so it's not about whether you see good or see poorly. It's do you see efficiently? Do your eyes work how we want them to work? Are they working together? Is your brain getting a clear picture on both eyeballs? And if they're not, it's not going to learn how to see very good, and you're going to struggle. And so those kids that are farsighted are often, do a little slower in school. They have a higher level of recidivism and just they don't accomplish as well.
Yep.
And it's not fair to those kids. It has nothing to do with what they're capable of. It's just that they were working 3 times harder than everybody else.
Mm-hmm.
And your brain only is capable of doing so much at the same time. And if you're spending all your energy making it clear, you don't have a whole lot of ability left to learn the information you're trying to take in.
So if a kid, I guess I'm just thinking about if a kid did have a vision problem and their brain is working overtime to try and correct that, what are the long-term effects if that kid never gets glasses?
Yeah, so the worst case scenario is that we have a big difference in prescription between our two eyes. One eye sees clear at a certain distance, the other one does not. Unfortunately, our eyes aren't capable of kind of differentially focusing. They focus together, and so one eye will get a nice clear picture, the other eye won't get a clear picture. That the brain in that for that eyeball that develops vision for you will not learn how to see clear, just as if you had a bad ear infection when you were a kid and there's some hearing issues for that. It's just deprivational vision loss, and that's what amblyopia is. And so those kids can have any number of issues, but their eyes just do not work together. Their brain just decides, oh, that left eye, for instance, is blurry. I'm just going to ignore it. It doesn't matter. Sometimes that causes the eye to point the wrong direction. Sometimes the eye points the wrong direction and it causes them not to learn how to see. And so there's just a couple different things that way that make it happen. But once that happens, unfortunately, by the time we're 6 or 7 or 8, the ability to get our brain to still learn how to work our two eyes together,
to correct it.
It's too late almost. And so, we can catch a kid when they're 9, but when they're 9, it's hard to make them whole again. And so they may never develop good depth perception. They may never develop clear vision in their eye. And so, God willing, something bad happens to their other, their good eye, puts them in a little bit of a tough spot, you can imagine. So,
right.
Not to mention things like certain careers are kind of ruled out for them before they even got a chance. Yeah. And so there's things like that are kind of long-term consequences.
Right. It limits a kid's potential.
Totally. And
yeah,
for lack of a better word, that's exactly right.
Mm-hmm. Okay. Because I have seen something that says 80% of everything a kid learns relies on their vision. So if 80% of what they're learning relies on vision,
then if we're working twice as hard to do it, we're putting them in a really tough spot.
Right. And like you said, that development is going to fall behind, and people are going to flag it as, there's something wrong developmentally when it's actually vision. Yeah,
what's not just developmental delays, it's pretty well studied. One of my colleagues actually did a study at the University of North Dakota. They took a bunch of college kids and they gave them ADHD test, and the kid, 98% passed this test. And then they simulated these kids being farsighted, equal amount farsighted, and 35% failed the test the second time. So just by having to put all this energy into seeing clear, it behaviorally can change a kid too. And
right.
So a lot of times there's conversations we have with parents that kind of go along the lines of, well, there's a small prescription here. It might not necessarily need this to see clearly, but behaviorally, if they're having issues, we might need to intervene a little bit. And so,
right. So you've been seeing some misdiagnoses of like ADHD and potentially some other things?
I wouldn't go so far as to say that it's been misdiagnosed, but it certainly could be part of the conversation.
Yes, part of the factor. Okay.
Yeah.
Very interesting.
Yeah.
Okay. Another question I'm curious about is the conversation around tablets and sitting in front of a screen all day long, especially adults with work, but also kids with screen time.
Yeah.
And then blue light. How does that factor into eye health?
Yeah. So there's a lot of different conversations about that. I think a little bit maybe differently than everybody else does, but blue light is definitely known to cause some issues. The biggest ones for people that I like to really let them know about is that blue light limits how much melatonin your brain produces. So if you have trouble going to sleep at night or falling asleep, you need to be putting your tablet away an hour or 2 hours before you go to bed. And so things like that are kind of like the easy button. I think the jury's still out as far as is your retinal health affected by blue light. We have this really, the eyeball's really cool. And
says the optometrist.
Yeah, the eyeball's got some pretty cool features that help us block, UV light and this blue light that's harmful and built into our eye. And so we don't really know. And I think some of it is some fancy marketing to get people to, purchase things or do things that they need to do. But, limiting screen time in general is a good idea for a number of different reasons. We know that nearsightedness or myopia is kind of becoming an epidemic in the Western Hemisphere. It's obviously been that way in the Eastern cultures for a long time. And we know that you need to be outside for 2 hours a day. You need to have sunlight hitting your eyes. And so the conversation about slowing myopia progression down, you can get pretty deep into that too. And so, limiting time, like anything, right, is in moderation. Moderation is usually a good answer, right? And so the blue light conversation, circling back, it's hard to know. Blue light does come off of screens and TVs and computer monitors and phones, but you also get blue light being outside. Mm-hmm. And so if previous cultures were outside all the time, all day, every day, and it wasn't some kind of vision crisis to them, I don't know if it's necessarily going to be one now.
Right.
Being up close is we have to focus our eye muscles, and that I can definitely see is different in the last 15 years. Kids and adults, for that matter, really don't have as strong of a focusing system as they need for that kind of demand all the time. And so people often get just little naggy vision complaints that are kind of hard to quantify, but they're, my focusing, you can tell it doesn't focus quite as fast as it should, or they get kind of a daily kind of headache 3 times a week. You can help those folks pretty easily by giving them a little boost so they don't have to do all the work themselves.
Okay. What does that boost look like?
They'd be like a baby bifocal kind of a thing, which is what I call baby bifocal. It's a pair of glasses that helps focus a little bit up close. Yep. It's not a traditional bifocal that we get when we're unfortunately in our 40s, like I get to claim to be.
Right.
but it works. I would say in my office, probably 75% of the kids I see need that in some fashion, and which would have certainly never been the case before. When I went to school, we would have talked about almost nobody needed a bifocal, less than 10%.
Yeah.
Until we got to 40, and now it's not even. I clearly have forgotten that information. I've moved on to with what the people need because it's a lot more common than we think.
So you were saying that there's a higher demand for this, like these tools to help us focus more. And are you thinking about that in terms of screen time and the way we're
Certainly.
Okay.
I mean, if we were a truck driver, we're probably not going to have nearly as much of those symptoms, and I'm not really going to be as worried about their
right, because you're always looking so far.
A little bit about weak focusing, right? But if we're an accountant and all we do is sit in front of our cubicle all day, pounding numbers and looking at really fine detail stuff, you're going to work harder as far as vision goes. And so I take it into account with everybody, and the industry has really built a bunch of new tools that specialized glasses that really help certain things. But it's definitely part of the conversation for patients. Health-wise, like I said, the jury's kind of out on health-wise if it matters, but certainly big functional changes for people.
Okay. So is it all about exercising the eyes? Because I've heard that if you work in front of a screen or kids that are in front of tablets for long periods of time, is it all about, okay, I'm looking at the screen for a while, I need to take an eye break and go look outside, look out the window. Is it all about like exercising?
That's exactly what I'm talking about. It's not so much about exercising, it's about letting your muscles relax a touch. If I were to give you, I tell my patients this kind of same story all the time. If I were to give you a 50-pound dumbbell and you're capable of carrying that 50-pound dumbbell, and I tell you to hold on to it for 45 minutes with your bicep flexed, and then I say, okay, now put that dumbbell down and just relax your arm. You think your muscle's going to be super relaxed the minute you let it down. It's going to take some time to relax, and that's what happens with our eye focusing muscles. So we get everything all tightened up looking up close, and then we look up from our phone or our tablet or whatever, and we try to see the TV, and it takes a second before the TV comes clear. It's because our muscles are kind of straining. We're reaching our level of how hard we want to work up close. And then it takes some time for them to relax and see far away. A lot of folks come in, complaints about, when I drive home from work, it's blurry. It's blurry when I drive at night. And I say, well, when you drive to work in the dark, is it blurry? No, it's great in the morning. It's a cumulative effect throughout the day. They just kind of get tight focusing. They can't relax and then see out in the distance. So really, their distance concern is an up-close problem. So I have this conversation with patients too many times a day to count, but a ton of time up close. And it's not good nor bad. It's just we need to be aware of the way it can make our eyes feel.
Right. So then going back to the foundation with the kids, how is all of this important for the kids with early detection? I know we touched on this a little bit of like why it's important, the detrimental things to, lack of potential and developing, but why really is it important for kids and families to know about Vision Start and to go to a Vision Start exam? Right.
The key or our goal, for lack of a better word, is there's really no good excuse for anybody to have a lazy eye that doesn't see. And when I say lazy eye, I mean it can't see. And because we could prevent them 100% of the time. And so if we're a foundation that is kind of rooted in sight and we want to improve the quality of life for North Dakotans, we need less kids that end up that way because they're less likely to achieve the same level as the other kids. And so getting kids in is the only way we can stop it from happening. The brain develops and starts putting the things together visually pretty quickly in life, and it kind of finishes up doing the smart stuff by the time we're 6 or 7. And so if we don't catch them before then, it's hard to intervene. There's been lots of studies done that you can still kind of improve a little bit later in life than that, but it's just so much easier when their brains are flexible and they're soft-brained still, and we can put a clear picture in front of that brain and it'll magically start catching up. And that's the key, really.
Okay. Yeah. So really the messaging is all about eliminating those vision problems, but the other flip side of that is parents just need to know that there's resources to give kids can go and get free eye exams.
Right, like as a profession, we've probably been throwing our hands in the air for this for 45 years. And so what we wanted to do is that, hey, we have this wonderful gift. We can eliminate any cost barriers for parents if that's the issue. But really, people need to know, first exam by age 1, by your first birthday needs to happen, right? We can give glasses to anybody. We don't need them to know their letters or pay attention. We use drops in most patients that are small, kind of to relax that focusing system of theirs so that we can shine a light. And by shining a light at you, we can figure out what the answer is. I could give your dog and cat glasses just as easy as I can give you glasses. It's not really technically difficult. It's just a matter of the people need to be there. And so I usually tell my patients age 1 is a good time. A lot of parents ask, of course, and they'll say, oh, my kids are 6 and 9. And I'm like, yeah, it's time. We should have done it already, but age 1, and then I like to see them again age 2 or 3, and then it depends on where we at, but annually after it, just to make sure. Most kids are born farsighted, and we're born farsighted, and that's fine, and we slowly develop closer towards normal, or perfect, for lack of a better word. I like to watch that, and if they're not changing fast enough, or if they start to be a little too farsighted, or things are a little bit different from one eye to the other, that's when we intervene and give them glasses. They're not going to know that they can't see at age 2 or 3. They can hardly talk.
Right.
In fact, it's sometimes easier when they can't.
Yeah. Right. But that intervention is crucial.
And that's when it's super powerful,
Okay.
too. I mean, everybody's seen the little video of the kid on TV going picking up the glasses and stares at mom and starts, everybody's so crying, cute. Right? Like everybody's seen that picture. Not every time it works like that, but it's just as powerful when the kid doesn't know any different. There maybe isn't a problem there yet. We don't know because they can't really read letters or tell us exactly what's happening. But when they get to be 5 or 6 and we know that they sure could have had that problem and they don't, that's a win, and it's what, makes you feel good to do what you do.
Right. Totally. Well, it's good to hear the recommendations for parents of, even before there's vision concerns, there should be eye exams for baseline reasons. And then if anything is flagged, that's where treatment glasses come in, but then it should be annual exams after that.
Totally. And at a minimum, before we're headed to kindergarten, we need to have an actual eye exam. Mm-hmm. A lot of states, there's a law, just like certain vaccines, of course. But we don't have that here, and which is fine. But if everybody knows it's going to be okay, we just need people to know that that's part of getting your kid ready for school or preschool, is that they need to know that they're capable of learning when they get there, not just, they're a little slow or things aren't going so good. Maybe we should dig in.
Yes.
Let's just know first before we run into problems.
Yeah. And I've seen the statistic that says less than 15% of preschoolers actually have an eye care examination before they enter any schooling, which is kind of scary when you said that we should be having them at 1 year old.
That's not very good.
Yeah.
1 out of 7, right? Or something like that. That's not great.
Yeah.
And so that's where we'd love to make a huge dent and get that a lot closer to 80-90%.
So then for parents that, again, going back to the whole screening versus comprehensive eye exam, for the parents that really don't know much about eye health or what they should be doing, and obviously the foundation is, the messaging is get free eye exams, like we have them offered. But for parents that don't really know about it, and then they're sending kids to preschool and they're getting these screenings from, like you said, a Lions Club, a school nurse, why is it important for them to understand the difference? Can you reiterate that?
Trying to just make sense of the numbers, I'm a parent. I've gotten the piece of paper back in the mail too, or it's just another piece of paper in the thing. And sometimes if you just gloss over what it says, you don't really know what the numbers mean, of course. And as long as it checked the box that says pass, you think that that's good enough. But screenings don't use things like eye drops to really relax their focusing system, so we don't get the true answer necessarily. So a lot of times there's some false negatives or false positives in those tests. And I mean, it's just such a simple thing. Like, give me 20 minutes of your day and I'll make sure your kid is going to be okay. Doesn't seem like too much to ask from a professional point of view, but there's just so many things about how eyes work together, how they team together, how they move together to help reading, and there's just so many things that can't be addressed by people that aren't trained in eye care. Right.
You want to get the professional's eye on the kid's eyes.
Right. You can think of 1,000 different professions. I'm not going to tell my primary care doctor how to take care of high blood pressure or, cholesterol. He knows what to do, and I'm going to trust what he says. Just because I put my arm in a thing at a CVS doesn't mean that I got it under control.
Right.
You know what I mean?
That's a good example.
It's a similar kind of conversation.
Okay. Yeah. So, Vision Start seems like a wonderful resource, and it's a free resource for parents across the state of North Dakota, where they can find a local optometrist in their city and schedule a free eye exam with them. So can you walk us through what that process looks like for how parents can get involved with Vision Start then?
Absolutely. We couldn't have tried to make it any easier than it currently is. We have a website, visionstart.org. Parents go to, basically click a button that says, do you have a child between 4 to 7? And if you click the yes button, it will take you to the second question. There's a question referencing household income with some pretty loose guidelines of what would qualify. And if it says yes, it says you get to pick your guy, where you want to go, which doctor you want to see. And from there, you make an appointment with that provider. That provider is reimbursed by the Optometric Foundation. They'll tell you everything you need to know about whether your child needs follow-up care, whether they need spectacles, what the story is. And then you've kind of established with somebody that they can follow your child to make sure that you're on the right path.
Okay. Wow. Yeah. It's like 1, 2, 3, easy process.
I'm pretty sure it's only 2 questions.
Yeah. I think I've looked at it. Well, okay. Well, that's great. So then after that, a kid goes and gets their free eye exam. So again, the messaging is just, even before there's vision problems, parents should be sending their kids to these eye exams, and they can get a free one with Vision Start.
We don't expect to ever, like, I think the incidence of amblyopia is like 1 in 20, or maybe even 1 in 100. This is why I shouldn't quote. This is why I shouldn't quote statistics. But we don't expect every kid to have this problem, but it's the ones that do. Is just as long as I get to check your child out and we can high five after we're done, tell them everything's going to be great and they're in good shape to go to school. Yep. That's just as useful as finding a kid that is going to have a problem, because sometimes if you don't know what you don't know, and you'll never know until you do it. So,
okay.
Yeah.
Wow. Okay. Well, thank you so much for coming on the podcast today and sharing so many things about eye health. I feel like I've never really sat down with an optometrist and talked about eyes. And I was like, well, kind of want to ask, like, what do your eyes do when you're sleeping? Like, just all the things. Like,
yeah, we could be here all day.
Yeah. So many fun questions. But all right. Well, I will wrap it up and we will catch you next time on the DMF podcast. Thanks, Jason.
Appreciate it.
What a great conversation with Jason today. I think it's crazy that 80% of what a child learns relies on their vision. That's why it's so important to stop and check out the Vision Start program, which offers free eye exams to kids ages 4 through 7. All right, folks, that is going to be it for today. Thank you so much for listening. We hope you enjoyed this episode, and we'll catch you next time on the DMF podcast.